Hey guys, so I am 3 days post-op, uh, and I guess I just wanted to walk you through what I've been through so far. Uh, I drove from Montana down to Salt Lake City to the University Hospital here in Salt Lake City, Utah, and the first day I got here, which was last Wednesday, I had an appointment with Dr. Agarwal's physician assistant, and she's really nice, and the whole staff is really nice and awesome. Uh, they gave me a whole packet that told me about like my post-surgical care and all this stuff. I got my prescriptions. I've been on antibiotics. Today was my last day of antibiotics. Um, and I have pain medications and an anti-nausea and Colace. So, because I guess antibiotics and painkillers make you not be able to poop. So, I got a prescription for that. Um, Things have been good here. Salt Lake City is really nice, actually. It's kind of cool. Um, the first day I was here, we went to an Indian restaurant, which was nice because we don't have that in Montana. Um, and yeah, it was really easy to find. Um, when you go in, there is a separate area where you have your appointments pre-op and post-op, and then there's a different building that you go to for the actual surgery. But they explain it all to you, and the buildings are right next to each other, so it's easy to find, and that's all cool. Um, when I went in for surgery, I don't know if it's because I've never had surgery before or like what my problem was, but I was like really nervous, and my blood pressure was like insane, and they but they were really nice, and um, they explain everything to you while they're doing it, and that was kind of cool because most doctors just come in and like do stuff and then they go away. But yeah, they explain everything while they're doing it. The nurse in uh, the pre-surgery and post-surgery room is really funny, uh, and she made me more calm, I guess. And afterwards, it was nice. She got me juice and stuff, so that was cool. Um, but yeah, I was really nervous before going into surgery. Um, but Dr. Agarwal's really nice, and she came in and did the markings. I don't think you can't really see any right now because this vest is on and it's gonna be on for the next couple days still. But um, I'll be showing you guys that too whenever the time comes, because I haven't even seen it yet. But I had Dr. Agarwal weigh it out for me because I really wanted to know. I had like an estimate. I thought it was going to be like 8 pounds, and no. So, pre tea and everything, I had a 36C cup, and that is apparently 2 pounds. So I lost 2 pounds. um, but yeah, so the day of surgery, I went in. My surgery was scheduled for 9 a.m. I went in and signed um, some paperwork because they're a university hospital, and um, the surgery is done at the cancer center, and so they um, wanted to know if I would release my tissues or whatever so that they can study like healthy tissue versus non-healthy tissue. Um, Pretty much, I guess, just because it's part of my body that I need to be like, yeah, you can take this and use it for research purposes. So I signed that, and then they walk you back to like your pre-surgery area. It pretty much looks like a regular doctor's office, and so you sit back there, talk to the nurse. She asks you a bunch of questions about anesthesia, sort of. Um, it's related to anesthesia, but it's not. The questions aren't necessarily like she asks you, do you smoke? Do you drink alcohol? Did you drink alcohol yesterday? Or stuff like that. Do you have a history of heart disease in your family? All the kinds of stuff that they need to know that might affect your anesthesia or how you react under the anesthetic. Um, and then they have all the surgical team comes in and meets you. I had a resident for that was my anesthesiologist, basically, uh, and she was overseen by like the main anesthesia guy, and they both came in. They were really nice and introduced themselves to me. Um, they shot up my hand with lidocaine before they even gave me an IV because I guess the needle was just that big. It would have hurt, but it kind of hurt anyway. So, um, but after it was in, I did not care because they gave me good things. So, uh, but yeah, they came in and at first, I met the anesthesia team first. They came in and gave me an IV with saline in it to hydrate me because you can't eat or drink anything before surgery from like midnight the night before, even if your surgery is at like 3 in the afternoon. So they gave me that to hydrate me, and I sat around for a little bit waiting because Dr. Agarwal was still in surgery at that point. And then when she was done, um, two residents were in there, I guess, learning how to do the surgery with her, and they came in and introduced themselves to me, and I guess they asked me if I had questions about the surgery and stuff like that, and I didn't really because I've watched so many YouTube videos that it seems like you pretty much know what's going to happen. Um, and then Dr. Agarwal came in, and that was awesome because she's so nice. Like, uh, and I don't know, she just makes you feel comfortable. I don't know, I just felt so much better after talking to her. Like, I was still really nervous, but like talking to her made me feel better. Um, Put me at ease, I guess. And so when she came in, we talked about the weighing, and we both put in our guesses. I said 8 pounds. She said 1 pound. We were both wrong, but still, that was cool. And so I stood up and she did all the purple markings, which are still going to be there, I guess, when this comes off. Um, and she told me about uh, the bandages that are going to be on me, which I'll talk about that in a minute. But she went through like what will be there when I wake up, pretty much, as far as the bandages and the stitches and everything. Um, and she said that my throat might be sore because of the tube. Uh, and yeah, so then after that happened, they all went. The three of them left the room and went to the operating room, I guess. And then the anesthesia team came back in. I got to kiss Jesse, and then he got kicked out. And they But before Jesse left, they gave me something in my IV. I don't know what it was, but I couldn't stop laughing. And at that point, I was like, "Yeah, let's do this," because I could not, I couldn't not laugh. It was awesome, actually. Uh, if that's the way to have surgery, yes, that's the way to go. Um, because the nervousness was driving me crazy. I was nervous from the day before, and like I said, I really don't know why. Um, so then they wheel you back because I had already undressed and everything. Um, you take everything off except for your underwear. Um, I had to take out my tongue ring and my earrings. They let me keep my ankle bracelet, um, but I'm assuming that it doesn't come off. Like they would have had to cut it off. So maybe if it's removable, they would make you take it off. But it didn't matter for me, I guess. So they give you little footy things to put on your feet with the little rubber on the bottom, so that you don't fall. I guess when you come out of surgery, and you have like a surgical gown on, and then they put that funky little hat on your head, and so that's what you wear into the surgery. They roll you in, and then they help you get yourself onto the operating table. Like, so you like physically put yourself onto the operating table, which I thought was gonna be scary, but it actually is not that bad because you're so like loopy and like uh, just ready that it doesn't really matter. So you put yourself on the operating table. Um, they attach these arms, and I just rested my arms on them, and then the anesthesia team put this mask on my face and just uh, they were like counting for me to breathe deeper, and then I don't remember anything. Actually, the next thing after that point that I remember is a nurse poking me on the shoulder saying, "Do you want ice chips?" And I was like, yeah." And then she was like spooning me ice chips, and it was done. Like, I couldn't tell that I was even wearing this, actually. Um, I could tell that I wasn't in the operating room anymore when I opened my eyes. There was just this nurse like standing next to me, like typing stuff on a computer, and then like I heard her say something to the other nurse that they were gonna wheel me into another room, and so then this other nurse comes and wheels me into this other room, and the funny nurse from pre-op comes in and she asked me if I wanted juice, and I was like, yeah. So she went and got me juice, and then all of a sudden Jesse was there, and then yeah. Um, at that point, that's where they teach you about how to do your drains, because these drains are in. Um, they put them in surgery, and then you have them until whenever they take them out. Um, hopefully, I get mine out on Wednesday morning. If not, then I have to remove them myself, or Jesse will remove them uh, sometime later this week. But they base it off of how much fluid is coming out. So uh, you have to squeeze the fluid out of them, and they go into these bulbs. I'll show you in a second. And you like measure the amount of fluid that's coming out, and yeah, pretty much this vest is really tight. It's like a compression vest, um, meant to keep the swelling down and to push that fluid out into the drains. Um, she, before surgery, was telling me about the bandages. So the stitches that I have, which I can feel it, I can feel the incision is like right here. The stitches along here is are dissolvable, they're all gonna dissolve. The only ones that aren't are gonna be the ones around my nipples, which are like here-ish, I think. Um, and my nipples have their own like uh, bandage on them that is sewn onto them to help them press onto my body, I guess. Uh, so there's like extra compression on just the nipples to help them like stick, and that will come off on. I get that taken off on Wednesday, and then I get to see everything, and then they're gonna teach me how to rebandage myself, and I'll have to wear this funky vest for another week or two um, to help with the swelling and stuff. And I can tell already, like, my ribs feel really bruised. That's like the thing that I was most worried about actually was post-surgical pain, and I really have not had any. I thought that I was gonna pretty much be dead and not be able to do anything, but I have been pretty mobile. We've gone and done something at least every day. The day after surgery, we went out to eat at the Olive Garden, and then yesterday we went out to Barnes and Noble. Today we went to the grocery store. So I've got up and walked around a little bit, which they told me to do because that helps to get the fluid out too. So um, the next couple days I'm not really going to be doing anything because Jesse left. So I think, I mean, I'll be up and I'll be walking up and down the stairs for my breakfast in the morning because it's free, but I won't really be up and about doing anything until Wednesday. Then I'll be traveling back home, I guess, and to the airport and the hospital and stuff, so I guess we'll see how that goes. But as far as the next couple days, I'm free to relax. um, yeah, so I thought maybe I'd show you the vest, and if you don't want to see the drains, then you can stop watching now. Um, but I thought that anyone that might be going through the surgery would think that this is helpful. So, here we go. I'm not supposed to use my arms very much, so like the way that she taught me to sit up is to hold your hands like this and hoist yourself up. So that's how I've been getting out of bed in the morning. That's really when most of my pain is happening, is right in the morning, because I haven't had the meds like all night. But anyway, here are the drains, and they go in on the sides. There's a hole like right around here on each side of my body. That seems to be like my most painful spot, actually, is right where the drains are going in, and I'm not really sure why, but I'm very excited to get them out. But anyway, you can see like there's fluid in the line, and every couple hours you just have to like squeeze this fluid down into the bulb. And then I have a little measuring cup and a little chart that I'm supposed to keep. And so I empty the bulb and write down how much was in it. And then they're going to determine on Wednesday morning if I can get my drains taken out. And they said that it really depends on you and your body. So if I'm healing fast enough and I have not that much fluid coming out, then I'll be able to get them taken out. So yeah, in my post-surgical packet, it says that they can still leak for like a day or two once you get the drains out. So that's why they have like gauze padding to put on the incisions there. Um, so, I mean, I'll let you guys know how it goes. But yeah, I'm 3 days post-op and I feel pretty good. I really am just tired from healing, and I wanted to give you guys an update. Um, I haven't seen any videos really about Dr. Agarwal. Like, I've seen like two maybe, but she's awesome, and we should get the word out because this is a really great surgeon and a great opportunity for people, especially in the northwestern US, or people that don't have the money to go see Dr. Garamoni, because he is at least $3,000 more expensive than Dr. Agarwal, and she is just as good, if not better. So I hope this video helps somebody, and thanks for watching. I guess I'll let you see my results in a few days, maybe up to a week, but thanks for watching.